So, who are fall prevention stakeholders? Who are the people who are interested or should be interested in preventing falls on their unit or in their facility? Quite frankly, the list is very long for these stakeholders for fall prevention. There's almost no exclusions to groups of people who should be motivated to reduce the number of falls. First, the patients themselves would want to know that they are receiving care in an establishment with low fall rates. Patients would also want to avoid falls because of concern for their own well-being. Patients come into this hospital or facility in order to receive the best quality care and to make an improvement to their lives, not to have additional setbacks. Next, nurses are stakeholders in fall prevention. Nurses are at the bedside with patients, and the heart of nursing is to provide excellent care to patients. This includes looking out for patient safety, and thus nurses will want to reduce their fall rates. Nurses are also stakeholders because incentives such as pay increases or unit improvements, which make their lives much easier, may be dependent on the amount of falls their units experience every month or every certain quarter. Doctors are stakeholders because while they are not at the bedside like nurses, their outcomes are dependent on proper care. For example, if a doctor has a high rate of falls in their surgical practice, the doctor will suffer from lack of patients trusting that doctor for their care. Even if the surgery itself is very successful, the patients will look at the whole experience when deciding to recommend that doctor to a friend or a family member. A doctor's results may also be altered by patient falls as well, thus causing the doctor to have to repeat or to fix the procedure due to no fault of their own. Other caregivers who could be included in this chart would be physical therapists, certified nurse assistants, and occupational therapists. Administration are also stakeholders because they are the decision makers when it comes to how to solve problems that are seen in hospitals or units. These are the people that nurses will go to in order to ask for resources to make changes such as improving patient fall rates. Administration is also responsible for the reputation of the facility, and if there are less patients, then there's less income being generated by that facility. Falls also increase the cost of care to the facility, as the burden of extended stays will end up with that facility as well. Insurance plays a part as a stakeholder due to the cost of care, which increases when a patient falls. The insurance will be requested to cover more costs than initially expected. Depending on the outcome of the fall, the patient may have additional procedures which will need to be covered. This cost may fall on the insurance, which relies on keeping costs down in order to having to increase costs to their patients that they already care for. As a whole, falls only provide more problems to all parties involved, and thus it is important that all team members do their part to reduce this burden.